It is January 7th, right? Today?
Mm-hmm.
January 7th. That's fantastic. So we're gonna do a question and answer. I'm gonna talk about some things. I want to talk about something that I absolutely love when it comes to um, a specific vitamin. That's, I believe, is very important. It's got some really, really good research when it comes to osteoporosis. And we all know somebody that has some bone density problems, but has some very good research. I have it right here too. I have 8 studies pulled up right here for some great improvement on osteoporosis. And I want you guys to understand it's important knowing the fact that when you are told about calcium, which is a very important mineral, don't get me wrong, but there's a specific fat soluble vitamin that is extremely important to where when it comes to vessel health, when it comes to osteoporosis, when it comes to, really administering things for, blood, and that's vitamin K2. Vitamin K2. Now, there's also vitamin K1. Both of them are fat soluble vitamins that play a massive role in blood coagulation, bone metabolism, vascular health. K1 is found in mainly leafy green vegetables, while K2 is found more in meats and fermented foods, so fermentation, and is also synthesized in the intestinal bacteria. That's why you'll notice that if you have a significant amount of treatments antibiotic-wise, you do have a problem with this, okay? One thing that I want you guys to really understand is calcium K2 really helps get calcium where it belongs. And if you look at, we've been talking a lot about atherosclerosis, which is a very devastating condition. It's a multiple factor thing that is contribute to why it's there. I believe that high blood sugars for a high period of time can affect vessel integrity, blood pressure, other deficiencies can lead to arterial damage, which now leads to plaquing, atherosclerosis, and therefore now I understand why people say, well, we got to be concerned about our cholesterol levels. Sure, but there had to be some damage first, but then if that's the case, you have to be concerned about cholesterol levels. You also be concerned about calcium. You have to be concerned about certain immune cells because once there is vessel damage, and that the barriers are down, it's going to be very difficult for plaquing not to build up. So what I want you guys to understand is this. Taking K2 is essential, making sure calcium goes where it belongs. If you do have a high calcium score in the arteries, you want to be doing a significant amount of K2 foods on a regular basis. It's going to take a long time to pull it out, but I actually just got an email. This is why I thought about this vitamin right away. Now I'm going to respond back to this person, but first of all, thank you for sending me the message. I'm very happy that you. I'm very happy that you now actually, send me questions and I will answer them. And I got this one I'm just pulling up here, right here. A consultation request. But what happens is this, I will keep the name private, but they're 65 years old. They're watching showing cholesterol and statins. His wife follows me and what interested because I've taken the statin for years. They have atherosclerosis along with controlled type 2 diabetes. The plaque, the calcium score is 2240. That's a significant buildup. Now, people say, Doc, does this person have to be concerned with high levels of cholesterol? Yeah, they do. Yeah, they do. See, once there has been some damage and some plaquing, you gotta be very careful about it. Now, do we still need cholesterol circulating our system? Yes, we do. We need it for many factors, and we cover that on the show. But we have to get the other factors under control. Now, the one thing is this. I even see them taking some good things. They list out their medications they're taking, but they also list they're taking fish oil. That's very good. I love that. I'd like to see that change to cod liver oil. They take a daily vitamin, they take vitamin C, they do some fruit and vegetable tablets, and they do a CPAP. But they take more medications and more medical stuff than they do nutritional things to help them restore and recover. So therefore, but I will tell you this, I want to see this person do other things, but when we really talk about that plaquing, we really have to not only talk about, vitamin K2, but also some Neo40, some nitric oxide, some things, and work out the other things so we can help you not only eventually wean off your medications as your things start to get better, but also, remember what I mean by wean off your medications, I will never tell you to get off a medication, but as we start to restore things back to health, you will actually end up having some situation to where you can see that. Now, this was just on talking about arterial health. Osteoporosis is very common, and it has the most significant, K2 has the most significant impact on osteoporosis of the studies when it does comes. Even, we need calcium, but we have more available calcium than we actually have available K2 based on what we eat. So K2 is so important for osteoporosis, so important. Yes, calcium, yes, vitamin D, yes, estrogens, no doubt, very important, PTH, parathyroid hormone, mobilization of calcium that way. But vitamin K2 helps it get into the bone. And they can, in taking it at a significant amount for a long period of time, people say more like, 450 micrograms and stuff of that would be a good level, which is true. And you want to do certain international units of vitamin D3, but K2 is essential. K2 is essential for of avoiding osteoporosis. Now, if people actually have osteoporosis, I want them to do a separate K2. I want to make sure that they're eating fermented foods, just because if you take synergistically vitamin D3 with it, which you need vitamin D3, but if you take it just as much, you're going to mobilize calcium, and you need to actually have it more direct where it goes, and you need to take a higher dose of vitamin K2. So that's being said, K2 is so important for osteoporosis. K2 is very important for atherosclerosis. Osteoporosis, atherosclerosis. All right. So I will be emailing this person back if you do have a question like this wonderful person did. And I'm really happy because it's a male. Women take a little bit more control of their health. I wish both males and females did it. So I'm very happy this male reached out that way. So I will respond back to you today and give you a little bit of direction, and we can start from there. And so Trinity and Hunter are with me today. So Trinity and Hunter, what do we have for our questions to start today?
All right. I'm starting the 30-day detox next
30
week.
Detox, yes.
Can you talk about the benefits?
Okay, 30 detox, can you talk about the benefits? Okay, what is the 30 detox when I wrote it, all right? What I'm trying to do is affect digestive health. I'm trying to reduce calorie intake. I'm trying to make sure that you get your macro, micro, and microbial nutrients. Trying to give your system just a relax, reset process. Keep some very easy digestible foods, because a lot of people do have some major GI problems. So the benefit obviously is taking the irritation away from the GI, from the stomach, from the small intestine, large intestine, which is going to be immune factors, which means there's going to be less inflammation. Hoping to get the bowel to move at a decent rate to clear things out. Hoping to support the liver, to support the pathways of both phase 1 and phase 2, and get some gallbladder stimulation and help some microbial balance within the GI tract with some bile release, because bile release is actually also antimicrobial when it comes to yeast and other overgrowths. Also, bile is very like a slip and slide for the intestinal tract, which we're going to get better bowel movements. So we're just going to start to support the digestive process from basically stomach, gallbladder, liver, intestines, pancreas, and the benefit is a overall reduction in irritation, irritable bowel, inflammation systemically and also locally, but also too there'll be some weight loss that's contribute to it. We got next.
Any insights or ideas for things to help with abdominal migraines in a child?
Any insight about abdominal migraines in a child? Actually, I will always tell you this. I don't have any experience with it that way, so I can't really give you any good advice or any direction. Obviously, there has to be something neurological that's involved. There has to be some neurological, toxic effects that come from something. It could be heavy metals. It could be, infections, especially if there's that kind of abdominal problems that are going on. But just like an irritable bowel, that can cause neurological issues. There might be some allergies. But I've just never have dealt with anybody that way, so I can't really give good advice. And I want to make sure that people know this. I look at the factors of, if I've had experience with it, or my doctors have, or I've dealt with it with my other docs that way. I will actually only give you opinions and stuff that I have some clinical, backing of success with. Yep.
Is there an herb that works just as well for headaches instead of ibuprofen?
I don't want people to try to replace medications with herbs or any nutritional thing because can there be some things that can mimic a little bit? Sure, there can. But if there's headaches, there's some irritation, there could be some structural issues, there could be some, because remember, the brain doesn't feel pain, so there has to be tissues around the brain, fascia, structural, muscular, your soft tissue, that is being heavily inflamed, and therefore it downright massively painful, and then it can irritate the neurological system and feel horrible. Can a person take California poppy, turmeric, and boswellia for some relief? Sure they can. Will it work with every one of them? No. Will it give at least some relief? Sure. But I would look at a little bit more detail of what's causing that inflammatory process up in the areas in order to actually see if we can find out what's really, triggering the headaches.
What are the best sugar alternatives? I've heard many things, good and bad, about things like monk fruit, allulose, xylitol, erythritol, and stevia.
So let's start here. What got me to be a doc was responding to foods, especially an egg. Now, if you know anything about what I teach, in general, I can teach you eggs are one of the healthiest foods on the planet, by far. But there is a certain amount of population that does respond negatively and even die from eggs. They can have an allergy, both IgE, which can be anaphylactic and very devastating. They can have type 1, 2, or type 2, 3, or 4 and have just some inflammatory reaction and can cause some irritation in your bowel and some other major issues and systemically cause problems all over. So it could be irritable or even just fatal. And therefore, any food source can be something that can be good for one person and bad for the other. In general, we see that, the alternative sweeteners like monk fruit, as long as it's done organically because it spoils very quickly. The sugar alcohols, especially allulose, and then xylitol and erythritol have some benefits, but also erythritol and xylitol can be made from corn. And if you do negatively respond to corn, it'll be bad for you. But the vast majority of people seem to do quite well with them, especially allulose. Xylitol, even the birch thing, people can have some GI disruption because it is a sugar alcohol. Stevia, once again, there's people that can handle that plant extremely well, and I've seen people react to stevia. But those things in general, when you look at monk fruit, stevia, allulose, xylitol, erythritol, on no sugar, they do really well, even though xylitol can raise blood sugar just a little bit sometimes, but still approved because it's very minimal. Now, if we're not on no sugar challenge, if you look, it's honey. It's probably one of my favorite sweeteners there are. I think honey is a very complete food. Now, does it have all the essentials? No, but it's just a very, very, very good food. Maple syrup is extremely good for you. But once again, can you react? There's people that react to honey. There's people that can react to maple syrup. So, but I just gave you some really good sweeteners there.
What can I do to support the healing of a torn MCL?
What can you do to support the healing of a torn MCL? If you tore it, you're going to need to go see a very good surgeon. And there's some wonderful surgeons all over the United States and have that taken care of. But then you want to support, that regeneration. You want to support it with like some collagen supplement or a bone broth. You want to take a good form of vitamin C in the form of sauerkraut, which is good for collagen reproduction. You want to do some red light therapy. You want to do some turmeric and boswellia to support its regeneration and keeping the inflammation under control.
So this next one's a bit of a long one, so
Okay,
bear
we
with
have a
me.
long one. Let's go on.
Can you talk a little bit more about the benefits of xylitol?
The benefits of xylitol.
My son-
Let's start here. It's a long one. Xylitol is a sugar alcohol, and I'm more in the form of birch. It's been known now to keep blood sugar much better, but it's also known for inner ear infections. Okay, go on.
My son has a gamma hemolytic
Yep, gamma hemolytic.
Streptococcus.
Yep.
Streptococcus.
Yep, streptococcus, yep.
Yep. Overgrowth and takes xylitol
Yep.
daily.
Good.
Are there
Take-
any other benefits of xylitol, and is there anything else my toddler should be taking to support his gut while we kill the overgrowth?
Yeah, so here's what happens. Great job that you knew about xylitol and its effect on the microbials. But then here's what happens. Whenever you look at microbials, you always want to combat it with other microbials, so take a good form of megabiotic. Also, oregano oil for a very short time would do wonderful. And then what you also want to do is this. Oral health is very important. I would also look at doing, a mouthwash that could be a coconut oil-based one, a xylitol-based one. I have a xylitol and a coconut oil-based one, and then a food-grade hydrogen peroxide, which would help out. Great questions.
Can you have withdrawal symptoms on the no sugar challenge, such as headaches, stomach aches, nausea, etc.?
Can you have withdrawal symptoms? Well, here's what happens. The idea of a withdrawal symptom is the fact that, number one, your blood sugar drops down. And therefore, you can go through a lot of symptomatology, including, lightheadedness, blood sugar dropping too quickly. Your liver starts to deplete its glycogen, which now other things can be released and metabolized. You have your muscles releasing glycogen when your blood sugar is dropping, trying to balance your blood sugar. You have cortisol levels starting to go up. You have adrenaline starting to go up. So can you go through a lot of symptomatology, especially after the first 3 to 4 days? It could feel like hell on earth. So absolutely. And there's people that will feel nothing. But I will tell you this, most people, unless they have a really, really, really bad metabolic or eat too many calories or just consume, other bad things besides just reducing sugar, they're going to lose weight. They're going to lose water. They're going to have things that their hands and feet and belly will be less puffy. Their face will be less puffy. There's massive benefits to just reducing your blood sugar for a time period, because most people keep their blood sugar too high for too long a time.
Diagnosed with ulcerative colitis during my 4th pregnancy 5 years ago.
Okay, diagnosed with ulcerative colitis.
Told
Okay.
there was nothing I could do to promote healing except infusion drugs. Any thoughts?
Well, it depends on your severity. Any autoimmune condition, you want to start with some high levels of vitamin D. You want to get your levels up between 90 and 100 in your blood work. And believe it or not, even a little bit higher based on, your level of autoimmune response. Then you want to, with ulcerative colitis, it's very common to have infections that exist with it. So you want to juice. You want to make sure that you have good GI function. So I'd make sure you have good sterilization of the stomach with some betaine hydrochloride. You want to make sure you're taking some form of megabiotic to restore some of the major bacteria to combat some of the overgrowths that are there. You can start lining it with like chamomile, green tea, and things like that. That's going to give you some regenerative aspect and mucous membrane production to coat it and have less irritation. And just make sure you stay very carnivore-ish, and because even sometimes fiber can irritate ulcerative colitis. Now, I would actually want to make sure that people eat as much fiber as possible. I try to make sure my girls eat as much fiber as possible. But sometimes with ulcerative colitis, irritable bowel, and other GI conditions, it's very hard for them to consume those things. So start carnivore-ish, then just eat some meats for a little bit, see how your belly responds with the other supplementation to help restore those things, and then you can start to add some fiber in and try to get the fiber up pretty high. But sometimes with ulcerative colitis, most people can't handle it right away.
Any supplement recommendations for RA? I'm 74, have tried many medications, and none of them help in the long term.
Well, nothing, even supplementation, with the exception of vitamin D, is going to help long term. There are turmeric and boswellia, which is going to see some temporary relief and actually without any really negative side effects. But rheumatoid arthritis, just what you talked about before, there's an autoimmune condition. Higher doses of vitamin D are going to be the most sufficient thing to really have an effect on the immune response. But RA is just like any other immune response. There's something irritating it. And it could be allergies, it could be an overgrowth, it could be infections, it could be something toxic. And it's the job of the person taking care of you to look at all those irritable factors and start to pull them away, because then there's an overall lowering of a systemic immune response, and therefore then the joints won't be as irritable or as irritated, and that'll give you a little time to help regenerate the joints.
I have a cold setting in my lungs. What should I take?
Well, make sure that you don't end up with any pneumonia. The vitamin D, sauerkraut for the vitamin C, OSHA, which is going to help a lot with the lungs and everything. OSHA is an herb; it's not the government agency. And make sure you get an X-ray, done by a professional, so you don't make sure anything's pulling down the lower lungs and end up with some pneumonia. Remember, always protect yourself. I think people, I've said this many times, I think people that are too tribal, that are all in the medical camp, I think are too tribal. When it goes too far, I think people are all in natural camp or goes too far. A lot of those answers are in the middle. One thing I got a response from a buddy of mine who's actually in the medical field, and I'll read his exact quote here. It's the season of COVID vax. It's crazy, the upper respiratory shit. Antibiotics, steroids, and inhalers for all. I think we should get a vending machine and pass out. That's how bad it is. So there's nobody, including myself, that sees the devastation right now of infections. And he himself, who's in the medical field and a medical professional, sees it worse in the COVID vax people than the non-COVID vax people. So, yep. All right, what we got next?
How to lower blood pressure in pregnancy?
How to lower blood pressure in pregnancy, it's going to change a little bit, but what you need to do is this. You got to make sure that you have enough potassium and magnesium, but potassium especially. Most people are potassium deficient because you need about 4,700 milligrams per day, and most people don't even close to that. So I want you to start with a couple thousand milligrams of potassium and start to build up from there, and make sure you're eating a lot of potassium-based foods, there's a list on our website. Good time for 2 more questions.
Why do my burps taste like rotten eggs after I eat?
Why is what?
Burps taste like rotten eggs.
Indigestion. I would say that you need to, why do your burps taste like rotten eggs? You need to actually increase the stomach acid, so you suffer from a little hypochlorhydria, and you probably have some, overgrowth and some infections, maybe some yeast overgrowth within the stomach, or even, overgrowth within the oral cavity itself. And so I'd actually get some betaine hydrochloride. I would actually get some aloe juice. I'd also start to, take some form of megabiotic, and I'd swish your mouth out with a hydrogen peroxide-based food-grade mouthwash.
My food sensitivity test came back saying I should avoid eggs and baker's yeast. Can you suggest a solid breakfast option?
Meat, meat, really. And you'll probably see those things dissipate pretty quickly if you stick with just good old meat for a little bit, because then your irritation is going to come down. Most allergies are just the immune system has been irritated, and now it responds to many things. And it looks at things as foreign, even normal foods. I lived with that. That's why I am in the position I am. I actually became a doc because I was failed by the medical field, and I just started to look and going, that's why I didn't go become an immunologist. That's why I didn't go become a medical doctor. That's why I went to more in the natural realm, because medical doctors failed me dramatically. And so I had to come up with a little different pathway. So, all right, guys, that being said, thanks for joining us today. I did get a couple questions already, and I will be responding to these people, sorry about that. And we will see you guys tomorrow. Once again, have all your questions, jump on there, and we will continue to answer things that we do have with you guys. You guys are awesome. We'll see you soon.